I asked the patient to relax and lie down and asked to expose patient's lower abdomen. First of all, I observed the contour of umbilicus to look for any signs of inflammation or hernias or peristalsis or aortic pulsation visible in the epigastrium. I tried warming my hands and my stethoscope, listened to bowel sounds by placing the diaphragm of stethoscope gently over each quadrant. Then I tried listening to abdomen before percussing because any obstacle can alter the bowel sounds. Then, if patient has high blood pressure or arteriosclerosis, listen in the epigastrium, aorta, then iliac arteries, and then femoral arteries. Then I tried percussing the abdomen lightly to assess the distribution of tympani and dullness. Tympani is a kind of music of hollow space filled by air or gas in stomach or intestine. Dullness suggests fluid or underlying organs like the liver and spleen. I asked the patient to let me know if he feels any tenderness. I tried palpating the four quadrants of the abdomen with my fingers together, placing my hand flat on the abdomen and pressing using light dipping motion. Moving smoothly, palpate all quadrants, identifying any tenderness or increased resistance to your hand. Please, can you take some deep breaths for me?
Okay.
Just to relax the abdominal muscles, I tried to palpate again the abdomen with the knees flexed. I palpated in all four quadrants by pressing more deeply just to check for any masses or tenderness. Checked for any signs of acute abdomen from inflammation of the parietal peritoneum. Liver examination. I perused the span of liver, first located mid-clavicular line, starting in the level below the umbilicus in the right lower quadrant in an area of tympani, percussing up towards the liver, even identifying the lower border of mid-clavicular line. I placed my right hand behind the lower thorax, lifting 11th and 12th ribs, overlying soft tissues, and left hand in upper quadrant lateral to the rectus abdominis muscle and well below the lower border of liver dullness. As the patient breathes, I tried feeling for the liver edge. As it moves down, try to meet your fingertips. If possible, let the liver slip under your finger pads as you feel its anterior surface. Starting to the right of patient's chest, I placed my finger of both hands below the border of liver dullness and pressed in and up towards the costal margin, and then asked the patient for a deep breath. When patient liver is not palpable, placing my left hand flat on the right lower rib cage and gently striking it with the ulnar surface of my right fist, and then asking the patient to compare the sensation compared to this side. For spleen examination, I placed my right hand below the left costal margin and pressed in with my fingers towards the spleen. When patient take a deep breath, I try to feel the spleen as it comes to meet my finger tips. The tip of the spleen is palpable only in 5% of normal adults as comparable to the rest. Then I ask the patient to turn right side with legs somewhat flexed at the hips, and gravity may bring the spleen forward and to the right into a palpable location so that spleen can be palpable. To help detect splenomegaly and enlarged spleen, I percussed the left lower anterior chest wall roughly from the border of cardiac dullness at the sixth rib to the anterior axillary line and down to the costal margin. There is an area called trop space. So, as I percussed along this route, noting the lateral extent of tympani, and if tympani is prominent, especially laterally, splenomegaly is not likely to happen. Then I asked the patient 2. Take a deep breath and I percused again. To palpate the left kidney, I moved to the left side of patient. I put my left hand gently in the left upper quadrant, lateral and parallel to the rectus muscle. Then I asked the patient to breathe deeply to capture the kidneys between my hands. Now I release the pressure of my left hand and feeling the kidney back to its expiratory position. So once again, we came back to the right side of patient to assess the patient's right side kidney. So I use my left hand to lift up from the back and my right hand to feel deep in the right upper quadrant. Then for the rest, I proceeded as we done in the left kidney earlier. For assessing aorta, I pressed the upper abdomen slightly left of midline and felt for the aorta's pulsation. Now, I tried assessing the width of aorta, pressing gently with hand on each side of aorta and then tried estimating its width. Normally, it should be less than 3 centimeters.